Now, Social and Behavioral Sciences lead for Child Health and Mortality Prevention Surveillance Program in Bombali District, Abdullahi Usman Bam, has called on health-related organizations to support in the fight to end infant and maternal mortality in the country. He made the call during Focus 1000's health volunteers collaborative visits to Cambia, to Bombali and Karene districts. Sulaiman Toure has more.
Over the years, Sierra Leone has recorded high rates of infant and child mortality rates without much knowledge about the cause, hence the formation of a research-based program known as Child Health and Mortality Prevention Surveillance Program in 2017 by 3 organizations including Focus 1000. Through this project, samples of the dead infant were collected and tested using modern techniques known as minimally invasive tissue sampling. From their research so far, CHAM's program manager, Bombali Abdullahi Uthman Ba, said the cause of death for majority of the infants and children was malnutrition, malaria, lack of management techniques by pregnant women leading to stillbirth after the child would have suffered from suffocation and sepsis, among others. Roughly, Mr. Ba said, from 2019 to date, they have conducted over 400 tests, but the number, he said, did not include every child in the district.
Upon receipt of all of these results, we back it up with the clinical records of the child, including the verbal autopsy interview we will do with the mother. When all of them are put together, we call it a DICO packet, and that DICO packet is sent to experts from Ministry of Health and other people who are residing outside Sierra Leone. They will have to review each of these cases to see what led to the definite cause of death of the child using the ICD-10 code of the World Health Organization.
To address the issue, he added, they have trained hundreds of nurses, provided emergency drugs for the Makeni Regional Hospital, and mentorship among others. CEO of Focus 1000, Mohamed Bailo Jallo, believed that lateness or refusal to go for antenatal care, poor support from partners, and bad breastfeeding habits were the other causes. Usman Ba saw the visit of the former Health Peace Corps volunteers as a blessing for more collaboration in the international stage. Due to their efforts in helping the communities they were stationed during their 2 years in Sierra Leone as health volunteers and social workers, Dan Smith and Scott Owata were honored with chiefly titles, and they expressed gratitude for such gesture. In another development, Focus 1000 has launched their global initiative geared towards creating space for international partnership in achieving their goals. During the launching, CEO of Focus 1000, Alhaji Mohamed Bailo Jallo, said, in as much as they try to achieve their local goals, they need international partners to score that goal, especially health.
Scott is running one of the biggest programs in America for homeless Americans or citizens there, and he has a lot of experience in dealing with that. So in fact, he can also bring in his own experience in helping us develop programs that are robust, that we can sell to international donors for support. So that's why I'm so happy that we have them today here to concretize this relationship.
The 2 former Health Peace Corps volunteers, Dan Smith and Scott Owata, promised to do their best in finding ways and means to connect the organization with universities and organizations in the United States of America. Representatives from various ministries in the country and international and national health-related organizations expressed delight over such moves by Focus 1000 in trying to improve the health and agricultural sectors in the country and pledged commitment to support in that direction. SLBC News.